Welcome to season 4 of Ask Dr. Leila, where we dive into all our specialists and why they chosen their specialties here at LH. Our first amazing guest is our extraordinary kids dentist, Dr. Safa. Thank you for being on our show.
Thank you for having me, Dr. Leila.
It's amazing always. So let's start by getting to know you. Why your passion to working with children?
Okay, so when I was in dental school, I used to love treating kids. And all my colleagues, and even after dental school, they used to encourage me to do more kids. They used to tell me that you have these skills where kids like you, and you have the patience to explain to them everything. And this is where I decided to focus on treating kids more than adults.
And I'm witness really to say, in all honesty, that when I've referred the children to you, the moms and the children have come back to me and said they absolutely love you. So patience is key, and just getting yourself to the level of children, being in their psychology, in their world. And you do that best, Dr. Safa.
Yeah, I'm so glad.
So pediatric dentistry is so unique. How do you approach treating young patients compared to adults? I think we just touched upon some points, but I'll let you further explain.
Okay, so it's totally different to treat kids than adults. Adults usually come to the clinic and they just want to get the job done and leave. Kids, they like to learn. They like to see everything around. So I like to show them first the dental tools and the procedure we're going to do. Show it to them, tell them what we're about to do, and then start doing it step by step, which make it different and give them a different experience to make them less scared or less anxious.
Absolutely. And there are some anxious adults, as we know, and they like to have the same approach. The rest of them, sometimes I'm like, would you like to hold the mirror? No, don't even show me. Just do what you need to do. So I agree with you. With adults, we have both. But most children, this is the approach.
Yes.
Correct, Dr. Safa. Why is early dental care so important for children? And at what age should parents start bringing their kids to see you?
Okay, so it's very important to start early, as early as the first tooth start to erupt, or we prefer to bring the child in their first birthday. It's not only about checking if they have early cavities or not, it's also about preventing cavities from starting and teaching the parent how to take care of their children's teeth by using the right toothpaste, by doing the right habits. And also we prefer to start this early for the kids to be familiar with the dental clinic and with the dentist, to not be scared when they grow up and need any dental procedure.
Correct. And it's truly, I've always said it's a partnership between what we do and what they do at home. So home hygiene, whatever they do as a team, as a family, caregivers, I always like to have caregivers involved, correct? And what age do parents, should they expect the first tooth to erupt? Around average?
So usually it starts from 6 months. Some kids, they even have it earlier.
Correct.
A lot of kids now recently, we're seeing that they have it later by the age of 8 months or
Yes.
9 months, which is completely normal.
Absolutely. It's within the range.
Exactly. It's within the range.
So you have a reputation for making dental visits fun and stress-free. Absolutely. What are some of your secrets to creating a positive experience for your young patients?
Okay, so there is no secrets. It's all about if you like your job, then it will be easy for you. I enjoy working with kids. I love their energy. I love everything they do. And I like to give them a positive experience. So I believe it starts from the beginning, how their parent make them ready for the dental visit. And
True.
then it's also about the team and how you prepare them for the dental visit. And then when they come in, I like to make it as fun as possible, as the way we explain things and the gift we give them, and if we can show them something to make it clear how the dental procedure will be done. But I think also it's all about the team. There is one patient who came to the clinic. It was his first dental appointment and it was his birthday. And it was so cute that the whole team started singing for him, from the reception, from the assistant, and also me. So I think it's about the work itself, the environment, and how you can do small things
Absolutely.
that can give him a good impact on the dental visits in general.
Very true. It's all about the memories.
Yes.
And the experiences that they take away. As we know, the fearful adults all comes back from childhood. The childhood trauma they had most likely in their dental visits. And it stays for such a long time. And it's hard to break that cycle. So once you start in such a great way, you've built this for life. You've installed it in them for life. And how do you work with parents to ensure their children maintain good oral hygiene at home?
Okay, so I always tell the parents that their job is as important as our job. And especially young kids, they like to copy their parents. So if they see their parents are brushing their teeth, they will brush it without them asking them to do so. They just want to do what the parents do.
They mimic. They're like parrots. Yes.
So I keep telling them, make it as a family activity. It's time to brush your teeth. Also the small habits about when to eat the sweet and all these details. It's all about how they do it as parents. So I like to give them the advice that whatever you do, your kids will do it.
Right.
And I think it's all about how the whole family do the process itself.
Correct. And I've seen you give a paper out with stickers sometimes that shows, Monday through Sunday, how many times, which on average should be twice a day for 2 minutes, as we all know now, brushing and flossing. And they kind of can check mark it for the younger kids.
We have a paper, and I always advise the parent to put it on the bathroom for the kids to see and to remember that it's
visualization.
Exactly, to brush their teeth. And they get excited to put the tick that they already brush it. And it's somehow rewarding for them.
100%. As a kid's dentist, you must have some heartwarming stories. Could you share a memorable experience that has stayed with you?
So there is a lot, but the one I remember is there was one kid. He was 3 years old. He used to come to the clinic and he had a dental phobia, literally. He was scared to even enter the dental clinic. So I saw him for the first few times in the reception until we got to the point where he comes to the dental clinic and he sits on the normal chair, not the dental chair. Now we reached to the point where he sits on the dental chair. And his mom tells me that whenever he knows he have a dental appointment, he wear his best outfit. And he put a perfume and he make his hair it's like he's going to visit.
Transformation.
It's like he's going to visit a friend or going on a special day.
And an outing.
Yes.
Wow.
And he insists every time to come to bring me either coffee or flower or whatever. It's like he's visiting someone he really loves.
Please make sure I see him the next time he comes. I would love to meet this young gentleman of yours. So for parents listening who might be anxious about their child's first dental visit, what advice could you give parents?
So I always tell them that your emotions will be transferred to the kids. If you're scared, the child will be scared.
Absolutely.
So it's all about what you feed them with emotions. So it's normal to be scared and anxious, especially in the first dental appointment. But it will be very good and helpful if they start early and there is no cavity. So at least they know that there will be no treatment.
Consequences.
And the parent will not be scared. And also I advise them to watch some of the cartoons or videos on YouTube. So there is a lot of videos that show kids the dental procedure in a very simple, easy way and fun way. And it will reduce the anxiety for both.
100%. And as we know, it's all about prevention, Dr. Safa, right? So if parents realize that this is all for their benefit long term and prevention is key, And like you said, if you start off on the right start with not finding cavities and just say, it's a simple, just cleaning and, looking at your
counting your
or
teeth.
counting your teeth, it just makes it all the better. And then coming in with so many issues. Very true. And before we wrap up, is there anything you'd like to share with our listeners about the importance of pediatric dental care?
So it's really important to start at early age because, as we said before, it's not only about treating cavities, it's also about preventing cavities from the beginning and how to develop an early healthy habits for kids.
Okay.
Also, I think pediatric dentistry is the key. It's the foundation.
Right.
If they start right and they have this good experience with the dentist, even if they have an issues later, it will not be as stressful as it is if they start at late stage.
Absolutely.
And also, now we all know that teeth are really important for kids in smiling, in talking, in having the confidence of eating or talking.
Yes.
So I think pediatric dentistry is as much as important as any other field.
100%. And as I see some huge things day to day with my adult patients, I really foresee that if someone starts at a young age, you really build a great future for them. So I don't think they will have as much issues, actually.
Yes.
And hopefully they'll get through old age and still keep their full set of teeth. Thank you so much, Dr. Safa, for being on our show today.
Thank you, Dr. Leila, for having me again.
And for our audience, the best takeaway message is to start early and prevention is key. Until next time, keep smiling.